For one thing, I'll tell you something that you probably will think we're nuts when we tell you this, but we use very little nitrous oxide, laughing gas. Very, very little. I would rather talk with the patient. I would rather have the patient talk with us, talk with the assistants, talk with the hygienists. We can, more often than not, talk them down from the ledge, so to speak. You know, it's a matter of spending time with them and communicating to them that, hey, we care about what happens to you. We really do. And I tell people this all the time. I mean, how many times a day? If this is hard for you, if this procedure is hard for you, or anything we ask is hard for you, I want you to know that it's not near as hard for us. So we want to do whatever we can to bring you to our level. Another way of saying it is, if it's hard for us, we know it's twice as hard for you. So what can we do to make this simpler? We're in your corner for a lot of different reasons. And they understand that. They go, okay. And we tell them, you can raise your hand to stop us at any time. Ask us a question. If you thought of a great joke and you're afraid you're going to forget it by the end of the appointment, whatever you think of, raise that hand and we will stop on a dime and figure out what we can do to make things better. Now, we also will use some sedatives and stuff. We don't do sedation dentistry, but just some mild sedatives. Lorazepam is a fairly common one that's related to Valium, but a little bit different level. We'll use that. They have to have somebody bring them in and take them home and stuff. But, you know, that is available for some people. We don't even use that often. Once people kind of get in here and they kind of see how we do things, it's a different, we want to prove to them that we're not giving them a line, that they're going to come in, they're going to get this done. We're going to get, at the end, we're going to ask you how to go. And you're going to tell us, oh, that wasn't so bad. You know, good. Because that's what we're aiming for, and that's what makes us feel successful when we go home at the end of the day.